One of the best vet schools in the world, the UC Davis Veterinary Hospital, has cared for millions of animals over 75 years. Surprises are rare, but every now and then, a patient comes along that pushes the limits of what's possible. Meet Viggo, a 3-month-old Maine Coon, a big breed with a big personality, and in Viggo's case, an unusually big head. Viggo's owner, Erin.
Just curious about the size of his head because he does have the nickname Megamind. But he is brilliant. He is the sweetest, smartest little boy.
A domed head isn't normal in a kitten, so we just wondered, what was he hiding?
Viggo's doctors say his MRI reveals a troubling diagnosis.
Inside of the brain, there is the area, like enlarged area, which is just filled with some kind of free fluid. The area is much bigger compared to the normal cat. We can see more than half of the brain is kind of filled with this free fluid.
This buildup of fluid in the brain is called hydrocephalus, and it can be deadly.
These kittens, they don't feel well, they're very dull, they may circle, and as the fluid backs up and puts pressure on the back of the brain, they can have a lot of trouble standing up, and when it gets terrible, their brain can actually herniate and they pass away.
When hydrocephalus strikes a kitten, the odds are grim. Because treatments are expensive and rarely succeed, most with the condition are euthanized.
So these are kittens that, I never say never. I try and treat everything, but this is something we've never had successful treatment.
For pediatric neurosurgeon Cameron Sadig, hydrocephalus is a familiar challenge in humans.
Humans and other animals have so much in common from a brain pathology and abnormality perspective. We share a lot of different diseases together.
UC Davis leads the way in human and animal health. When those teams join forces, it's patients like Viggo who benefit. Dr. Sadig and the veterinary hospital now have the chance to collaborate on a procedure that could save this kitten's life and bring hope to future patients, animal and human alike.
I know he's going to be in very good hands with the whole team. So, all right. And he seems very excited about it.
Inside the Children's Surgery Center at UC Davis Children's Hospital, a hydrocephalus procedure begins. Just like in Viggo's case, humans with hydrocephalus have too much cerebrospinal fluid in the brain. Patients can be born with the condition or acquire it later in life from a head injury.
In the pediatric neurosurgery world, we have a lot of children who are suffering from some really difficult, challenging conditions where the options that may be good enough for most kids are still quite poor options.
The standard hydrocephalus treatments work, but Dr. Sadig believes they can be better.
We've been using a technology that, although it's effective, it hasn't changed in about 70 years.
To relieve pressure from excess fluid that pushes the brain against the skull, treatments focus on replumbing.
We essentially have a type of plumbing system that we implant in humans, where we carry fluid from one space to another space. It's like having IV tubing that just goes from your head to another part of your body, like your abdomen. And that's been good enough for so long that many people don't think it's a problem anymore.
This primary treatment is called a ventriculoperitoneal shunt, or VP. Risks include infection, blockage, and the need for later surgeries if the shunt fails. To get a VP, a baby has to be a certain size.
These premature babies in the neonatal ICU are so tiny, and so we often do the bridging technique, tried and true, until they're big enough to get the tried and true shunt.
This bridging technique is called a ventriculosubgaleal shunt, or VSGS. It drains the fluid to a reservoir under the scalp.
The other technique, which is also, I would say, tried and true, but not a guarantee to work in all cases, is what we nickname the ETV. And that technique is great because it doesn't require any plastic tubing to be put in the head. So it's the most minimally invasive and the most natural of the treatment options.
ETV, or endoscopic third ventriculostomy, uses a small camera to enter the fluid spaces of the brain, called ventricles. A surgeon makes a small hole in the floor of the third ventricle, creating a new pathway for the fluid to drain naturally without a shunt. But ETV often fails in the tiniest babies whose brains are immature. Dr. Sadegh, who's also an engineer by training, has a new idea for the smallest babies, a combination treatment that marries the piercing technique of ETV with the bridging of VSGS.
It might just bridge the brain long enough until the brain does get the biomechanical changes where then the ETV is favorable. And by that point, the ETV is already open and it'll keep working for the long term. That could be the winning ticket here.
Viggo's case opens the door to discovery. Dr. Sadegh and the School of Veterinary Medicine are ready to adapt this groundbreaking combination of procedures for Viggo, potentially saving the kitten's life and offering hope for the smallest of baby hydrocephalus patients. Surgery day for Viggo. Dr. Karen Verneau brings him into the pre-op room where his care team preps him for the procedure. Viggo's owner, Erin, hopes they can save her kitten.
I just knew that he was in good hands, that they were going to do everything that they could to help him recover and survive this, because I know that their 100% goal is to do no harm.
Dr. Verneau is relieved that Viggo made it this far.
We have experience in kittens with hydrocephalus who suddenly die. And so the concern was that he could change at any moment.
A cat's brain is similar to a human's, in structure, but not in size.
It's probably a quarter or a third of the size of a preterm infant. Pretty small.
Dr. Sadegh is lending his human experience to the animal team, including veterinary neurosurgeons Ji-Hae Lim and Adrian Dupenlu, for this first-of-its-kind surgery in a kitten.
We'll have to find this opening, get into the third ventricle. That's the hardest part.
For that, they'll use an endoscope, a tiny camera that's only 1 millimeter in diameter. It fits inside a slender tube called a catheter. Dr. Lim begins with a small hole in the skull, the entry point for this delicate procedure. Now they're ready to navigate Viggo's brain and try to relieve his hydrocephalus by piercing the tiniest of holes.
Shielded by this catheter, this endoscope then is peeking into the brain. And we're looking at the fluid spaces in this sort of magical underwater type voyage, looking for all the right neuroanatomical structures. This is the basal ganglia. So finding one outlet from one chamber, ventricular chamber in the brain to another. And once we were able to really navigate that look around, we would then move to the next step, which is finding the bottom of that third ventricle chamber of the brain, and then deciding at that point, where are we going to pop in? And pop through one part of the ventricle and the chamber into a part of the brain that is essentially very core and the riskiest part, which is right in front of the brain stem. And there is a very large artery that runs down there. And it was just amazing that moment when we got in for the first time and could see this big artery down in the brainstem pulsating right in front of us. And once we had that view, we gradually pulled this camera backward, leaving that catheter in that space. And that was essentially accomplishing the first two steps, is the ventriculostomy, making the hole, stenting it open with the catheter, and then when we pull all the way out, we then want to connect that catheter up to the surface above the lining of the brain so that some of that fluid could disperse under the scalp as well as a backup option. And that was the third and final piece. And so when we finally zoomed out, we could see fluid that was moving up through the catheter. We had seen all the way down to the depths, the danger zones, and there was no hemorrhage, no other concerns. So at that point, we were very happy to close the case and at that point, close the skin over and get Viggo back on his way to recovery.
This first-of-its-kind procedure is complete. Now the wait begins to see if their combined effort can save Viggo's life. 4 months later, Viggo returns to the UC Davis School of Veterinary Medicine for an exam and an MRI. Dr. Verneau has some concerns.
After surgery, Viggo was not neurologically normal, so he had issues with the cranial nerves on the left eye. He was circling to the left, and he had a condition called diabetes insipidus, so he needed some medication to treat that.
Viggo's owner, Erin, says he's also not grooming himself. She's trying to get him to play with the other cats.
Just helping him improve day by day, doing not necessarily physical therapy, but reintroducing how to be a kitten again.
So he's still on the road to recovery and improving every day, at least outwardly. The real test will be to see what's going on inside.
We did the MRI scan to check the status of his brain and to see if the hydrocephalus was improved or worse, or was there anything else we needed to worry about, right? Because this is a new procedure.
As the images come in, they're carefully examined and compared to images from before the surgery. Doctors look for a reduction in cerebrospinal fluid, a sign that the new procedure is relieving Viggo's hydrocephalus.
He definitely had improved. He had a little bit of bleeding, so that was the unexpected finding, but the hydrocephalus itself had improved.
On the Human Health campus in Sacramento, Dr. Sadig evaluates the results that he's been waiting months to see.
The first thing I did was start scrolling from the top of the head. And as I start scrolling down, the first thing I see is that, oh my goodness, the outer part of the brain looks thicker. And then there was some gap actually on some parts of the skull where the brain had sort of relaxed inward a bit. Immediately I knew that's great. And as it got down lower and lower, I could follow the catheter going, and it was right where we had left it. To me, it says that the catheter and that new hybrid treatment we arranged for him actually is working. And this many months out, I think it speaks really well to the long term.
It's been 6 months since Viggo's surgery. Erin and Viggo couldn't be happier.
Being the first ever, we really didn't know what the recovery process was going to be. I feel like we have Viggo at 95% back, like being a kitten and playing, and he's grooming, he's eating, he's playing with the other cats. If anybody else were to come here, besides looking at his eye, no one would guess that anything's wrong with him.
It's a huge improvement from his last checkup and a drastic difference from the typical cat with hydrocephalus.
It's a roller coaster of emotions, I think, just knowing where we came from to where he is now. So happy that we were able to save him and see him thriving. Viggo, Viggo.
I'm thrilled. He's alive and well, and she loves him, and hopefully he'll live a long and happy life. This brings hope for kittens where we had no hope before.
A life extended thanks to a procedure that could save more lives in the future.
Him being a part of helping not only other animals, but humans, babies, it's amazing.
Viggo's surgery is just the beginning of what the teams hope to achieve. First in more animals, then someday in humans. Already, a second kitten, Moose, has undergone the same procedure.
My hope is that we'll get to try this several more times and see the longer term outcomes, get a sense for what the range of potential complications could be, and then with that, more confidently provide that as an opportunity, a new option to provide to, some human patients.
I think it's such a positive thing to work together on a project where we each bring something different to the table, and maybe we can make health better for all at the end.
A big team effort to save a small kitten, thanks to a collaboration combining human and animal health expertise that can be found only at a place like UC Davis.
He is a normal kitten. That's all I could hope for, because the quality of life is the #1 goal. And UC Davis gave him that, and I couldn't be more grateful.